Hi, I'm Suzanne here with Caregiver Haven, and we have a couple of really great questions sent in from our members that I want to discuss with you today. These are things that I have seen over the years. The first question is, I opened my mom's kitchen drawer and it's all pill bottles, loose labels, old directions, random blister packs, and creams. It's all same medicines with different dates. And she says, well, I know which ones are current. Well, I don't believe her. And then last week, she took her night pill in the morning and she felt weird all day. I need a simple system fast before she takes the wrong thing again. And this is from Kelly in Michigan. Well, Kelly, I've seen drawers, cabinets. I've seen so many medications that you cannot believe. But what you're going to do first is you're going to make an outline of these medications. You're going to start with one page. That's it, one page, and you're going to name the medication, the dose, and the diagnosis. The diagnosis is why they are taking it. There's always a reason. This is in medicine. You must always have a reason, a diagnosis, before you can prescribe that pill or that cream or that vitamin or whatever you're prescribing. What is it for? There's got to be a diagnosis, okay? And this also includes any medications that she takes randomly. It might be Tylenol. It might be ibuprofen. It could be an allergy medicine she takes when she needs it, okay? As needed, those medications still go on this one medication list. The next thing you're going to do is you're going to separate and only put on that list the current medications. Throw the other ones out. Now, ask your mom to do this, because when you ask her to do it, she participates. It's her control. It's not yours. You're not controlling her medications. She is. So ask her, say, we want to get rid of these medications. If she doesn't want to get rid of these medications, that's okay. You're going to take all the medications to the pharmacy. Let the pharmacist get rid of the medications. There's always a backup plan to whatever we try to do and they say no to. Okay? So we're going to first make the list. Make the list of all the current medications and why she is taking them. What is the diagnosis there? Then you're going to take that list, and if she helps you, you're going to take that list to the pharmacy. If she doesn't want to help you, you're going to take all these medications to the pharmacist. All right. Then the pharmacist is going to do a reconciliation. Going to get rid of all the duplicates and get rid of all the old meds. They're not coming back to you. They're going to be gone. Next, you can always use a pill organizer. It can be a weekly pill organizer, or it can be a monthly. People like different things. But what I will tell you with this is that if she is wanting to keep her pills or her creams or whatever in a drawer, that's fine too. They just have to be labeled. All right. So you might be able to put some slots in between there for morning, noon, and night, and she can see what she's taking and when. You can also put an extra slot in there called as needed. So make these trays up. Just put some trays in there, morning, noon, and night, if she wants to do bottles. That'll work too. But that way you keep her organized. And Kelly, one more thing. You're going to need to do this regularly. Maybe every month you want to recheck those trays. Maybe every week you want to recheck those trays. As your senior gets older, I have found that many caregivers have to do this almost on a daily basis, but it still gives their parent control over how they want to lay out their medications. So they may not want to do that pill organizer, but again, you have a backup plan, and that is these plastic trays you can throw in a drawer for morning, noon, night, and as needed. Okay, let's look at the second question that we have today. And that question is, Dad refuses a pill organizer. Well, we've talked about this. He lines the bottles up by vibes. I'm not sure what vibes are. Yesterday, he took his night pill in the morning and said, it's fine. It's all medicine. It goes to the same place. Then he got sleepy, snappy, and blamed me for changing things. If I mentioned a pill box, he acts like I'm taking away his independence. How do I organize this without a blow up and without making him feel controlled? there's a couple of things we can do here. And this is from Brent in Arizona. Thank you for sending this in, as well as Kelly. Thank you for sending your question. First of all, you're going to make the outlines of everything that he's taking, and you're going to put it on that piece of paper. Make it about control, not about age, okay? Your dad is lining these things up, feeling vibes. He doesn't care. His doctor said he has to take it. And many times in my own medical practice, I would ask a patient, why are you taking this medication? That is a key. And most people would say, because the doctor prescribed it. That is not an answer. It's the same thing when patients would come in the office and they would say, I'd say, what brings you in today? And he might say, my wife. That is not the answer I was looking for. I need the diagnosis. I need the chief complaint. What is going on? So in this case, you want to search for that chief complaint, that diagnosis. Why is he taking it? Is he taking it because there's a rash? Is he taking it because of an allergy? Is he taking it because of high blood pressure? Not that his doctor prescribed it. There's got to be a diagnosis. So make it about that this is a medication management system, that this is about you controlling, not somebody else controlling your medications, but this is about you controlling them. Then take it to the pharmacist and maybe even have the pharmacist call the patient directly, not you. You have had this conversation. You're going to start planting seeds, but let the pharmacist go over these medications or invite your dad in to do what's called a medication reconciliation. And what that means is in the medication reconciliation, you give a list or a bag of medications to the pharmacist. The pharmacist will spend a lot of time going over the interactions, whether the medications should be taken with or without food, which medications can be taken together, which ones cannot be taken together, and which medications are for what diagnosis. Now, sidebar here for a minute, I just want to share with you is many of my patients, once the doctor told them why they were taking the medication, they said, but I don't have that anymore. I don't need that medication. And so it was discontinued. So this is a way of clearing out medications that maybe your dad doesn't need anymore. So that lessens the number of bottles on the counter that he calls vibes. Okay, you can also try the 2-bin method. The current medications in one bin and the stopped or old medications in another bin, whether that's a drawer. And I would suggest a drawer, or those old medications, just put them away. Just put them somewhere. The thing you want to do here is you can do a quick daily medication schedule after all of these medications have been reviewed by the pharmacy, and make sure the pharmacist says you can take this here and this here. So if this helped you, subscribe to the channel, give it a thumbs up, and share it with someone who's drowning in pill bottles right now. And be sure to check out the free tool that I have to help you. It's amazing, and it will even have questions on it that you should be asking the pharmacist. Notice I don't say doctor, I said pharmacist, because the pharmacist is an expert in medications. It's in the link in the description. Take care, and I'll see you in the next video. Bye-bye.